Water is another name for life itself. Long before the first heartbeat, before the first breath, life began in water. From the smallest cell to the vast complexity of the human body, life has always depended on one simple truth: the balance of fluids. Inside us, there is an invisible ocean, a perfect blend of water and electrolytes flowing, shifting, adapting with every moment. Every beat of the heart, every electrical impulse in the brain, every breath drawn into the lungs depends on this delicate dance. It is a story of precision, of survival, of harmony. Today, we open the door to this remarkable world, the silent symphony within, and understand the art of fluid and electrolyte balance. A story that began with life itself and continues in each of us, every second. What is fluid balance? Fluid balance refers to the dynamic equilibrium between the amount of fluid we take in and the amount we lose. It is essential for maintaining homeostasis, the steady internal environment required for survival. This balance ensures that tissues are properly perfused, that the body's temperature remains regulated, and that acid-base balance is maintained for cellular processes. Achieving this balance is not accidental. It's carefully controlled by multiple systems. The kidneys filter and conserve fluids. Hormones fine-tune the adjustments. The nervous system detects changes, and even our natural behaviors like thirst play a role. Without this balance, the human body cannot function optimally. Our body constantly loses water throughout the day, and these losses are classified into two types. First, sensible losses, which are measurable and visible, including urine, feces, vomiting, and any fluid draining from wounds. Second, insensible losses, which are not easily measured. These occur silently through evaporation from the skin and water vapor from the lungs when we breathe. Several factors influence insensible loss, such as body surface area, surrounding temperature, humidity levels, breathing patterns, and even fevers. Recognizing both types is critical when calculating a patient's fluid requirements. Importance of fluid and electrolyte balance. Maintaining the right fluid and electrolyte balance is fundamental to the survival and efficiency of every cell in the body. It preserves cellular homeostasis, ensures that organs perform their vital functions, and maintains stable blood pressure and circulation. When this balance is disrupted, it can lead to dehydration, swelling, or edema, and serious disturbances in blood electrolyte levels, such as dangerously low sodium or high potassium. Each of these conditions can quickly become life-threatening if not recognized and corrected early. On an average day, a healthy adult consumes approximately 2,600 milliliters of fluid. This intake is a combination of direct oral fluids, water content from solid foods, and a small amount generated by metabolism. Similarly, the body's output matches this intake through urine, insensible losses from the skin and lungs, and small losses through the gastrointestinal tract. Monitoring a patient's intake and output helps healthcare providers detect early signs of dehydration, fluid overload, or hidden fluid losses. Water is distributed throughout the body in various compartments. Total body water makes up about 60% of an adult's body weight. About 2/3 of this water is intracellular, stored inside the cells. The remaining 1/3 is extracellular, divided further into interstitial fluid, which bathes and cushions cells, and plasma, the liquid component of blood. A small specialized volume known as transcellular fluid is found in spaces such as the cerebrospinal fluid, pleural cavity, and joints. Although transcellular fluid volume is small, its integrity is vital for specific organ functions. Several factors determine how much water our body holds. Age is a major factor. Newborns have about 70 to 75% of their body weight as water, and this decreases steadily with age. Sex differences also play a role. Men typically have more water than women because they have more lean muscle mass, which holds water. Obesity significantly reduces body water percentage because fat tissue contains less water compared to muscle. In clinical practice, we must adjust fluid calculations accordingly. especially for obese individuals. In critical care and hospital settings, estimating body water accurately is essential. We use simple formulas to guide us. Total body water is approximately 60% of body weight in kilograms. Of this, about 40% is intracellular fluid and 20% is extracellular fluid. Precise estimation helps clinicians administer the right amount of fluids during resuscitation, surgery, and intensive care. Fluid movement dynamics. Inside our bodies, fluids are never still. They are constantly moving, flowing from one space to another, ensuring that every cell, every organ, stays nourished and alive. This movement is not random. It's guided by beautiful forces working in harmony. First, there's hydrostatic pressure. Imagine it as the gentle push of blood against vessel walls, encouraging water to leave the bloodstream and bathe the tissues. Then there's oncotic pressure, a powerful pull created by proteins like albumin, drawing water back into the vessels, protecting the blood volume. When these two forces are balanced, our tissues are perfectly hydrated, not too dry, not too swollen. But when the balance is lost, when pressure builds too high, or proteins are lost, fluid escapes, and we see swelling, edema, even life-threatening fluid shifts. The silent movement of fluid is one of the most crucial and most beautiful dances within us. But how exactly does this fluid move? Nature has gifted the body with several marvelous mechanisms to manage it. Diffusion, the simplest, most natural way. Here, solutes like oxygen and electrolytes drift from where they are crowded to where there's space, a gentle spreading out, seeking balance. Then there's osmosis, the great equalizer. Water flows toward areas where solutes are more concentrated, trying to dilute them, trying to make everything just right again. Sometimes, though, the body has to work harder. That's where active transport steps in. Using precious energy, cells actively move ions like sodium and potassium exactly where they are needed, against the tide. At the level of our capillaries, tiny blood vessels, forces called filtration and reabsorption decide how much fluid stays in circulation and how much nourishes the tissues. Renal fluid management. The kidneys are our body's master regulators of fluid balance. Every day, nephrons, the functional units of the kidneys, filter about 180 liters of blood plasma. Yet almost 99% of this filtrate is reabsorbed, leaving only about 1 to 2 liters to be excreted as urine. Changes in urine output, even subtle ones, are among the earliest indicators of fluid imbalances in the body. Monitoring urine output is, therefore, a critical part of patient care. Hormonal control of fluid balance. Hormones fine-tune fluid and electrolyte balance. Antidiuretic hormone increases water reabsorption by the kidneys, helping to conserve water during dehydration. The renin-angiotensin-aldosterone system promotes sodium and water retention to maintain blood pressure and fluid volume. Meanwhile, atrial natriuretic peptide works in the opposite direction, helping the body eliminate excess salt and water, lowering blood pressure. The coordination of these hormones ensures a finely balanced internal environment. The thirst mechanism. Thirst is our body's natural alarm system. When blood osmolality increases, meaning the blood becomes too concentrated, this leads to the feeling of thirst, encouraging fluid intake to restore balance. However, as people age, the thirst sensation weakens, making older adults particularly prone to dehydration. Listening to our body's thirst signals is essential, but it's especially important for caregivers to monitor hydration in vulnerable populations. Clinical implications and risk stratification. Certain populations are at higher risk of fluid and electrolyte imbalances. These include neonates, elderly patients, and those critically ill in intensive care units. Clinical monitoring must include accurate intake and output measurement, regular checks of serum osmolality, electrolytes, and hematocrit levels. Appropriate adjustments to fluid therapy based on ongoing losses and changing organ function are necessary to prevent serious complications like shock, brain swelling, and cardiac arrhythmias. osmolality and osmolarity. Osmolality and osmolarity both measure the concentration of solute particles, but there is a subtle difference. Osmolality measures particles per kilogram of water, making it more precise for clinical evaluations. Osmolarity measures particles per liter of solution and is commonly used for intravenous fluids. Understanding plasma osmolality helps in diagnosing conditions like dehydration, overhydration, and toxic alcohol ingestion. Tonicity describes the effective concentration of solutes that cannot freely cross cell membranes. It influences the direction of water movement across cells. Isotonic solutions maintain cell size. Hypertonic solutions draw water out of cells, causing shrinkage. Hypotonic solutions push water into cells, causing them to swell. Choosing the correct type of fluid, isotonic, hypertonic, or hypotonic, is critical to avoid worsening a patient's condition. In a healthy person, drinking water, eating food, and normal metabolism are enough to meet daily fluid needs. But in hospitals, in sickness, and in recovery, the body often cannot keep up. Maintenance fluid therapy steps in when a person cannot drink or eat adequately. It provides the body with the essential water, electrolytes, and minimal energy needed to sustain life. Imagine a patient recovering after surgery, too weak to sip water, or a child with a high fever, unable to keep fluids down. Maintenance fluids become their silent support, preventing dehydration, protecting their organs. The goal is simple yet vital: not to overload, not to starve, but to gently maintain the body's delicate balance until it can take over once again. Like a steady hand holding a fragile cup of life. Replacement fluid therapy. But sometimes maintaining is not enough. In illness, the body may lose fluids aggressively through vomiting, diarrhea, bleeding, burns, or heavy drainage. In these moments, we must not just maintain, we must replace. Replacement fluid therapy is about restoring what was lost. It's about studying the nature of the lost fluids. Was it rich in electrolytes, acidic, alkaline, and choosing the right solution to bring the body back to balance. It's about acting quickly, wisely, and precisely. Every drop matters. Every decision matters. Because when we replace wisely, we are not just giving fluid, we are giving the body a second chance at survival, at healing. Replacement therapy is not just science. It is care. It is compassion in action. Dehydration represents a net loss of water, affecting all compartments: the cells, interstitial spaces, and the bloodstream. Clinical signs include dry mucous membranes, decreased skin turgor, lethargy, and concentrated low-volume urine. Dehydration can progress quickly, especially in children and older adults, leading to serious consequences if not recognized and treated promptly. Fluid and electrolyte balance is one of the most remarkable achievements of human physiology. It works silently, day and night, maintaining the miracle of life within us. Understanding this balance empowers us as caregivers, students, and health professionals to protect and heal more effectively. Thank you for being part of this important journey. Stay tuned for the next chapter, and always remember, in life and in medicine, balance is everything.